in the interest of time, just go around the room and give us your name and your position and the organization you're with, so everyone has a sense of things. And we won't get into the details about your organization, so we can dig into the activities. So I'll just work around what I see. Cheryl Kimball, could you begin, please?
Hi, I'm Cheryl Kimball. I'm the manager of philanthropy at Huggins Hospital in Wolfboro, New Hampshire.
Perfect. Maddie?
Hi, I'm Maddie Fadke. I'm the Major Gifts Officer at Anna Jakes Hospital in Newburyport, which is a part of Bethesda Lahey umbrella. This is my week 3 over here, so I have a ton of questions and a lot to learn.
Super, thank you. Susan Swift.
Hi, my name is Susan Swift. I'm the Development Director for Friends of Children in Amherst, Massachusetts.
Thank you. Danielle?
Hello, I am the Development Manager Northeast for Dogs for Better Lives, and we train service dogs for deaf adults and autistic children.
Great. Marianne?
Morning, I'm Mary Ann Rooney-Hegan. I'm the Director of Development here at St. Anthony Shrine on Arch Street in Boston.
Super. Heidi, and Rebecca will be next.
Hello, I'm Heidi Daniels. I'm Vice President of Development at the American Liver Foundation.
Hi, I'm Rebecca Allen. I'm the Leadership Gifts Officer at Samaritans in Boston.
Thank you. Leslie?
Hello, Leslie Lopez. When I registered for this session, I was the Director of Advancement at Maryknoll Missioners. Since that time, my position was eliminated. I've been in the industry for over 20 years, and a majority of my philanthropic years with nonprofit has been in the Catholic philanthropic community. I saw no reason not to attend.
I'm glad you did, Leslie. And Leslie is an alum of Plan MGO, a 4-day immersion program, Master Gift Officer program we did many years ago. So great to see you. Jeremy.
Hi everyone. I'm Jeremy Cadden. I am at Two Life Communities in Boston, and I am the Major Gifts Officer, and we have a lot of people around, so I'm wearing my mask. Sorry, I can't show my full face right now.
It's all right. So you'll please mute in the meantime. Thank you. Jennifer Ashley.
Good morning, Jennifer Ashley, Univest Foundation Planned Giving Officer in beautiful downtown Souderton, Pennsylvania. Love all you from Massachusetts. That's where my kids are in school, so I feel kinship with you. Thanks for having us, Larry.
Glad you could join us. Anik?
Anik Sullivan. I work for Columbia for a small center that helps local youth in Harlem and Washington Heights, that prepares them to go to college and help them for career and everything.
Thank you. Lisa.
Hi, I'm Lisa Orlandini. I'm a new visiting nurse and hospice donor engagement officer. I just relocated to Upper Valley, Vermont from Northeast Pennsylvania. I came up last summer. So just a few months here, the position and in the area. Thanks for letting me be here.
Thank you. Meshel, and then Kathy.
No, that's okay. It's Mikkel Piper.
Mikkel.
I am the Development Director at North Shore CDC based in Salem, Massachusetts. We are an affordable housing organization and many other things too. Thanks for coordinating this today. I'm very excited.
Sure thing. Kathy.
Hi, I'm Kathy Friedberg, and I serve on the Development Committee for a couple of different nonprofits, but I'm actually representing Plugged In Band program, which is in Needham, Massachusetts today.
Thank you. Sarah.
Good morning, everyone. I'm Sarah Struy. I'm the CEO of the Spina Bifida Association. We're located outside DC in Arlington, Virginia. It's nice to see everyone.
Welcome. And I'm sorry, Thuston?
It's actually Trisha Houston. I apologize. It's just a username, I guess, and not my full name, but it's Trisha Houston, and I'm the Director for Resource Development at Guthrie, which is a health system based in northeastern Pennsylvania, Sayre, Pennsylvania. We also have hospitals in New York State. And it's great to be here. Thank you
Great.
for having us.
Great, everyone. Thank you. Did I miss anyone? All right, so let's dig in. So we are here to talk about, to get to the bottom of ways to improve your major donor pipeline. And the Socratic method, I'll walk you through it real quickly, is many of you submitted challenge statements, which I appreciate. We're going to address those that I think encompass the issues that everyone expressed to the best we can, because we're not going to get through all of them. And so the person who was going to be featured, I'm going to refer to as the member, okay? So the member, we're going to ask questions of the member after I read the challenge statement so that you can all become better informed about the issues, or how they're doing things and so forth, and issues that you think might lead to a solution. The member will then revisit the challenge statement to see if it's maybe should be changed or modified to be more focused. Then the group is going to provide solutions to the challenge. And again, I'm going to be the bad guy. I'm going to be facilitating and making sure we stay on track. Okay, and it's questions and solutions, and we'll try to have a little in between. Then I'm going to ask the member, what did they hear that really stood out to them as something that they can really use, and ask for what commitment the member is going to make and what time frame to execute on what they heard. And then I'll ask the group what stood out for you as something you think you can use in your shop. But first, let's quickly talk about what is a major donor pipeline. Who's in it? Who's in the pipeline? I have my sort of criteria, and I'm sure there's more to it, but I always look for loyal donors, people who have made many gifts to the organization over time. A total giving, high total giving. May just be 2 or 3 gifts, more people on their way. But they've given a lot. A high average gift. So you may have many loyal donors, but you want to separate them out as those who have high average gifts relative to the others, right? A one-time high gift. There's a reason that person did that. Even if it's a silent auction buy, they're in your event and they're spending their money. So you want to know who they are and see who knows them. Research capacity. Some people, you've had some referrals and people have said to you, and you've done your research and the referral has high capacity, you want to have them on your list of top prospects. Philanthropic behavior. They give to like organizations. They give generously to like organizations. So you want to look at the organizations with which you have a kinship, and if they publish their top donors, capture those names for your screening list. And then large political donors. There's a linear relationship between large political giving and large philanthropic giving. So in your research, if you find that, you want to make sure those people are represented on your top prospect list.
Well,
okay?
These things happen,
I'll ask
we have
people
no
to mute
control
if they're
over
not.
it. But I'm delighted that you're well otherwise, that you're mobile and everything is
Who is that?
Getting around. Is Greg doing all right?
It looks like it's June from who's highlighted.
June Miller.
Okay, June, please, or I'll do it. Mute. Okay, we're there. Maybe not. June, hang on. Hang on. Yes. Okay. She is muted. Thank you for your help. I didn't see the highlighted box for some reason. Okay. Our first challenge is from Danielle. All right, Danielle, Development Manager Northeast, Dogs for Better Lives. Your challenge statement. Our nonprofit has been around 44 years, but on the West Coast. We are opening our new dog training campus on the Cape in April. How can I build a Northeast donor pipeline? I think a lot of the things that we learn from this are going to apply to all sorts of issues that others have. So right now, Danielle is the member, and I'm going to ask people to ask Danielle directly questions you need to know in order to be able to offer solutions to her challenge. Who wants to kick it off?
Do you want these questions verbally or over chat?
Verbally. So Michelle, Mitchell.
Mikkel, that's okay.
Okay.
No worries.
Mikkel.
No worries. Is your organization allowed to do events? I know like how you, if with the pandemic.
Yes, but in the pandemic, we're looking at more hybrid.
Okay.
Kathy.
Do you think that maybe some of your donors on the West Coast have East Coast connections?
Yes.
Marianne.
Why do you want to open on the Cape, on the East Coast?
Well, it's already being done, but because we wanted a better hub to serve our clients on the Northeast, and it makes a lot, well, the whole East Coast, makes a lot more sense to be training the dogs both on the West Coast and the East Coast, and the East Coast dogs, in theory, go to Northeast and West, stay on West, travel time and stuff.
Why Cape Cod?
Oh, there was a property that was up that was already a dog resort, so very little changeover on what we had to do. So it was exactly perfect for what we need. So just a little bit of renovation.
Great. Jeremy.
Yeah, hi. Sorry, you might have said this a few minutes ago, but I'm just a little unclear as to the purpose of the organization. Can you just say a few more words? Is this for the dogs or for people or both?
Both. We train service dogs for deaf adults and autistic children. So yeah, so helping the people at the end of the day, but it's a lot about the dogs. Both shelter and bred too. There's two different programs.
Maddie.
So do you have any board members or advisory members who are on the East Coast?
We do. We have two in Massachusetts, one in New York, and one in Florida, I believe. So we do have some donors out here. They just haven't been stewarded in forever. So I'm kind of looking to get some more too.
Sure.
I'd be curious about how you acquire donors on the West Coast.
That's a good one. I'll have to look into the history. I believe it started a lot with clients just telling their stories as ambassadors, and we have a lot more out there just because that's where we've been. But I'll make a note to actually get a better answer to that one.
Teresa, is it Teresa? Do I remember correctly?
Trisha.
Trisha.
Daniel, I was wondering if there are any other organizations that are similar to yours, at least with training service animals or other organizations around even rescue dogs and things like that.
Yeah, and I have been looking at their 990s to see who else is supporting them. Out in New England, there's Needs, and across the United States, there's Canine Companions, and we work very closely with Canine Companions. When they have dogs that don't work for them, we trade back and forth and such like that. So I am looking. Good question.
That's good. Some of you are seeing these cartoon hands up, and you can get to those via the reaction button on the bottom right of your screen. So Lisa.
Yes, I'm just wondering, you said the facility or the property you purchased was a dog resort before. Do you have access to the client base that utilize the resort?
Yes, and we will be continuing dog boarding as some of our earned income. So good idea.
And I was curious from an accessibility of their income and their finances, whether or not they'd be the good donors too, as well as consumers.
Good point.
Good point. Jennifer.
Are you a volunteer using organization or?
Yes. COVID messed that up a lot, as I'm sure a lot of organizations. So pre-COVID, we had people coming in, walking the dogs, people who, when we get the dogs from puppyhood that raise the puppies for a year and then bring them back to us. People that volunteer as ambassadors, either they have a dog themselves or they're just really enamored with our mission and have been spreading the word in their area. We look to have more volunteer opportunities in the future. Pre-COVID, we used to have school groups tour the West Coast campus. Right now, that doesn't make sense in this situation.
Thank you. Ms. Piper.
That works. Do you have any connections with nonprofit organizations that with deaf adults or autistic groups?
Yeah.
I live in Beverly and there's a deaf school up here too, so.
Wonderful. Yes, we're working on building those. The first ones I reached out to are Cape based, but yeah, I'll look into Beverly as well.
Kathy?
That was a question that I had. I didn't know if you dealt directly with the individual that needs a service dog, or if you worked through an organization that advocated for the individuals that might need them.
Usually the individuals find us, but every once in a while it's through, like, they're working with Deaf Inc. or they're working with the Mass Coalition for the Deaf, and they say, hey, have you heard of this organization? The other thing that sets us apart is we're the only one in the United States that gives the dogs away for no cost to the client. Everybody else can't afford that. We're just very lucky to be in a good financial situation, which is a blessing and a curse. It's like, you're in a good financial situation, so then what's your need? Why, you know?
Right, because there's a lot of organizations, I'm sure there are everywhere in the country, but, and I used to work for the Charles River Center, which serves the children and adults with, you know, under.
Great question.
Thank you so much.
Jennifer.
I was just thinking, trying to put my question together in my head about your board members and what connections they have specifically on the Cape. But my understanding is that you don't care where the donors are from.
Correct.
Particularly, you just want them to give to the West or the East Coast Center, correct?
Pretty much, yeah.
Okay.
Just give to the organization. Doesn't matter where you're based. We're just focusing because we're so brand new to Massachusetts. Low-hanging fruit here first.
Got it.
Okay, let's see, Rebecca.
Since your organization has been around for 44 years, do you have an extensive database where you can segment and look into donors not only from the East Coast, but high capacity, and maybe start sorting your list that way?
And we have a ribbon cutting coming up and at the end of April. So I've been looking specifically at who we have in the East Coast, and we have about 3,000 that have given in the last 5 years from the East Coast, but it's mostly low capacity people.
Good one. Teresa.
I was just curious about local health systems or hospitals. Sometimes if they have community benefit grant programs, you may be eligible for some of that funding depending on what the community needs assessment are in that area.
Makes sense. I haven't found those specifically yet, but I just made a note.
Great.
Heidi?
Do you have any connections to other veterinary places? Because people love their pets, and if you can work with veterinary groups to get them.
Yeah, very good point. The vet space has been ridiculously overworked in the pandemic when everybody got new dogs. So we do have some connections with vets that come into us. But as far as getting any more bandwidth than that, it's ridiculous right now. But you're right. The people that give to us, it tends to be they're interested in the dogs, not they're interested in the people, which was counterintuitive to me when I joined, because my best friend's deaf and I have an autistic kid. I care about the people. That's why I came in.
Interesting. Anik.
Yeah, have you thought about maybe contacting organization for autism?
Yeah.
I had an interview years ago with one based in New York City.
Yep. Thank you.
Kathy?
Yeah, I was actually going to mention that too. The like there's actually some foundations specific to autism.
Yeah, and they tend to give to individuals out here. I've looked into Flutie, I've looked into some others, and they aren't a fit yet, but they're on our radar just to keep them informed when they have clients that could come our way.
Right.
Marianne.
For free too.
I was wondering, we have a veterinarian school here, Tufts University. Cummings Foundation in Beverly is very supportive of them.
Yeah.
Check out who's on their board or who gives to them. And perhaps some of your donors, who knows, they could be graduates of Tufts, but it's another resource for you.
That's
I'm all
great.
about
Thank
connecting
you.
dots.
Oh, I love that. Thank you.
Good. I'm going to take one more question and then ask a question. Kathy?
No.
Are you, Kathy, is your hand still up? Do you still have a question?
You're on mute, Kathy.
Okay.
Actually, good.
So Danielle, if I were to write a check to the organization, do I need to designate it to East Coast? Are you just trying to raise more money for the organization to support the East Coast? How does that work?
So we would prefer general operating funds, but right now we're focusing on East Coast in that there's a lot of not cause specific, more like you're starting up renovation, capital type stuff that we're focusing on as well. But yes, right now, all the money coming in goes to programmatic. All the rest of our expenses are covered by a nice endowment we have.
So it goes to the mothership.
Yes, and that means out here it'd be hiring trainers and really building up the training program. But yeah.
So you don't have a separate balance sheet.
No.
Okay. Thank you. So great questions all. So I'm going to ask Danielle, given your challenge statement, based on questions, do you want to revise it in any way, revisit it in any way?
Yeah, it's not necessarily about finding the new people. It's a little bit of both. It's new people, but also really evaluating who you still have in your donor base too, and using those connections. So I don't know how I'd reword that, but that's kind of what popped up as people ask questions.
So like in all pipelines, you're always trying to feed it, you're always trying to find new and elevate current donor.
Right. And it's a heck of a lot easier to get the current donor to keep giving. I get
Right.
that.
Renewing is easier than acquisition.
Yeah.
No doubt about it. Okay. Solutions, everyone. This is the really fun part.
Mm-hmm.
So I had a general idea.
ahead.
I feel like as you go along, creating this Northeast space and all that, it seems to me that you might benefit from kind of reframing yourself as a national organization rather than East Coast, West Coast, and continue to spread the pipeline. I think that's a long process, or a longer process. And I also just wanted to say, I was just at Tufts Cummings School of Veterinary Medicine yesterday, and I noticed they have a donor wall and they have a brochure about philanthropy that I myself took. So I just wanted to pass that along, that I was there spending a lot of money yesterday. So
Our sympathies, we all share your pain, all right?
Wonderful place, though.
Any other thoughts? That's a good idea.
So Danielle, do you have a large social media following, or are you big on social media?
We're getting there. That's relative. We do have active social media with a marketing team actually managing it. It tends to be more West Coast based because that's just where we were. So growing it out here.
Yeah, I think, I mean, just if your messaging is something like you guys are expanding, your impact is expanding, something like that in social media, and just tagging a few things on the East Coast, or like, you know, for example, even the Tufts veterinary, I think that would lead to more networking and more channels, I guess.
I want to suggest that you look at organizations that have a chapter model. A lot of disease organizations have chapters that have local volunteer corps, local events, local galas, and so forth. And some of those models can be, I think, valuable for you to learn from.
Thanks. That's how I started out in the chapters of the disease space. So you're right. There's a lot of stuff to take from them.
I had tagging on the tagging part of social media. I mean, to tag groups like Chewy.com or the Bissell Foundation for Pets, so that maybe they may do or respond, so that gives you a bigger audience that might be.
Leslie.
A lot of the thoughts that I had have been expressed, but I also heard you say that you're launching at the end of April. And based on not only segmenting your current database, but a lot of what was discussed gave you avenues. So I think that hybrid webinar for your loyal supporters, and even reaching beyond, that, but I don't know how much you have planned, but I think that's going to be a large time, a grand time to announce your statement, even if introducing becoming a national. But I noticed that April is very, very key, and I have so many notes here. So
thank you. Yeah, we're doing a hybrid ribbon cutting. We're expecting like 20 people on the ground being there, and then streaming it YouTube Live and doing it late enough in the afternoon that West Coast can still tune in as well, because we want people across the country to celebrate it. Thank you.
I'm going to suggest two things. One, invest in direct mail, hard mail, particularly on the Cape. Capers are very provincial. There's on Cape and off Cape.
Yep. I keep telling my Oregon bosses that. They don't get it.
Yeah.
They'll get there.
So in a way, being on the Cape sort of limits you.
Yeah.
Unfortunately. And so just moving forward with that in mind, I think will be valuable.
Makes sense. Thank you.
Okay. Anything else? So I am going to ask Danielle what you heard, one or two things that stood out for you that you want to share with us.
Well, I heard a lot of good things, but I put in quotes, impact is expanding. I think that's a brilliant way to put it, and I wouldn't have gotten there without you guys. And I like that in my head, I've been thinking East Coast versus West Coast just because we were brand new to the West Coast, but you're right. Put it back into the national framework and you're just supporting national. We happen to be out here now. I probably need to reframe that and write a better message statement that way. So thank you. This was really, really good.
Wait, when do you think you're going to do that?
Soon as I have a few meetings after this, but end of day, I've got some time. No, I'm the type of person, if I don't jump on it, I don't. I have a 4-year-old. I know my time is precious.
It goes away. I want to ask the group, what stood out for you as something that you might be able to apply to your own situation? Okay, all of you are not national organizations. So not in some ways of thinking, applicability is less. Because
I feel like, whoops, sorry.
Go ahead.
No, I feel like thinking sort of beyond your own category is something that I don't know about everyone else, but I kind of forget about. We get, I've worked in historic preservation, I've worked for an animal shelter, and now I work for a hospital, and we get kind of category focused. And I feel like there's a lot of thinking that could be done. Like Danielle has a unique kind of perspective or position of having this very animal focused nonprofit that also really is also very people focused. And so just kind of broadening my thinking about slotting myself into a category of who might support us is something to keep in mind at all times.
This exercise, Cheryl, you've put your finger on it, is to help everyone get out of your silo, get out of your framework that you use to look at your organization. This enables you to try and do that. We have a new member, Joel. Why don't you introduce yourself, title, organization?
Sure. Hi, everybody. Sorry about that. I had another conflicting appointment, but my name is Joel Simonson. I'm the development manager of Love and Spoonfuls. We are a food rescue hunger relief organization based in Boston, but provide services throughout Massachusetts.
Great. Okay, we're going to move on to the next. Right? Jennifer Ashley, Plan Giving Officer, Univest Foundation. I'll read your challenge statement, but then you're going to need to tell us more about Univest. Okay. We have many donors who have been giving the same relatively small amounts for years. How do we convert these donors to major donors? The core issue for everyone. Okay, and good for you for asking it. So tell us about Univest Foundation and let's take it from there.
Yes, thank you. Univest Foundation, we have foundation in our name, but it's just a tad deceptive. What we do is we help individuals with their philanthropic dreams. Basically, we're helping them develop those dreams, usually through a donor advised fund, but we will work with other methods. The other thing that I do is I help nonprofits build their plan giving programs. So I'm always looking at two sides. I help nonprofits, and my nonprofit world, believe it or not, stretches as far north as Boston's North Shore, all the way down to Washington, D.C. So, you know, my stretch is big, and where we're located outside of Philadelphia, Pennsylvania, I cover 6 counties dealing with individuals. So that being said, many of my individual givers have been giving a little bit over the years, but I want to help them realize they can be big donors because I know they have the capacity.
So are you effectively a community foundation?
Not really. We're a bank established foundation. Univest Financial Corporation is a bank. And they started the foundation to help people be philanthropic.
So it's similar to the Fidelity Fund, for instance.
Similar, yes, but
Fidelity
way
Charity
smaller.
Fund.
Way smaller.
Everything is smaller than a Fidelity Charity Fund. So, okay, I think we have a picture here. And frankly, I mean, though you're not, there is kinship to community foundations here.
Yeah.
They have to raise their own operating money as well as populate donor advised funds and so forth. Mm-hmm. Right? All
yes.
right. Questions? You can raise your hands. Danielle has the first one.
Are you cause specific or just trying to get money for people to be pretty much DAF donors to whatever cause they want?
Whatever cause they want, and it runs the gamut.
I'm sure. That's awesome.
Teresa.
Jennifer, do you currently meet one-on-one with investors? Or donors, I guess?
Yes. I meet more one-on-one with the individual donors, not so much with the nonprofits, just because of the geographic span.
Okay, Jeremy.
Thanks. I'm curious. So you're trying to take already existing donors and raise them up to a higher level? Is that
yes,
you're trying to encourage the people already in your network to do more, to be more philanthropic? Is that the
yes.
idea?
Yeah, I'll take new donors too, but
stepping up current donors.
Yeah, that's really the point of the question.
Okay.
Yes.
And they're giving to other organizations.
Sure.
Yes.
And we all are.
Yeah.
Right? We're no different than they are. Sarah.
I have two questions. Is that okay?
Yeah, go for it.
First of all, do you have a stewardship plan in place?
Not really. No.
Do you offer the ability to make a recurring gift?
You mean automatically? No. Well, sort of. If they have an account at our bank, yes, they can. But other than that, no.
Okay. I'm sorry, I have one more
You
question.
get three.
Go.
I get three. Three for the price of one. Do you do online giving? And if so, what's the lowest amount what's the first amount that you put on all of the donations that you make?
Sure, that's a great question. We are actually developing the ability right now to do the online giving, to give through our website, through your donor advised fund. Lowest amount is $100.
Yeah, the ask string is important, as it's called, the ask string. Joel.
Thank you. Do you, or has the organization thought about connecting donors with the specific nonprofits that they're supporting with their funds, and actually providing opportunities for them to engage with their mission?
We do that when the donor wants to. The beauty of a donor advised fund for some people is that they don't have to connect. But we do try and encourage people to connect. We want them to connect with all of you. We want them to be involved. I'm for you guys. Yeah.
Do you have giving societies?
No.
Teresa.
Have you ever offered like a challenge match or a matching gift opportunity if someone donates?
No, we haven't.
Okay, and then just kind of along the same lines, have you ever offered like a competition for your nonprofits that you're kind of promoting, to see if they would want to share like a big idea and engage your donors that way?
No, haven't. Thank you.
Cheryl.
Hi. One question is, do you do any direct mail of any kind to your donors?
Yes, I directly mail them each about twice a year. And we do have an e-blast system that we send out twice a month.
Okay. And how, sorry if someone asked this and I missed it somehow, but how do your donors find out about projects that they might support? Or is it from you, or do they bring things to you, or do you contact them saying, you know, someone reached out to me with this particular project that they're looking for support for?
So yes, when I have a donor who hasn't given for a while, I do write them a letter explaining some of the big things the nonprofits they've given to in the past are doing.
Okay.
And basically say, you know, if you're interested in starting giving again, here's, you know, some of the causes you've loved, what they're doing. Am I matching a lot of people with nonprofits that they potentially could give to? Not so much. And I'm only allowed to do that when they ask.
Ms. Piper.
Thanks.
Apologies if this kind of got discussed already. Is smaller donors to larger donors specifically for all of the organizations that you fund, or are we talking just about the Univest Foundation?
Oh, just to the Univest Foundation. So how do I get people to up their games of their donor advised funds so I can encourage them to get the funds out to the nonprofits?
Okay, so do you ever talk about the needs of your foundation when in your marketing materials, or when you meet with donors, like help us help others? Like, is that part of the conversation?
We don't focus on the Univest Foundation. It's helping you help the causes you love is kind of what we talk about. Because Univest Foundation, we don't really do anything except help get the funds out to nonprofits.
So you're not raising money for your own overhead?
No,
The
we
bank's
get
pick-
overhead
bank's
from some of
picking
the
it up.
fees. So yeah, so I don't specifically have operating money I have to raise.
Okay, Susan?
Yeah, do you have staff who are researching your donors to see, who can tell me, updating what their interests are? So that you have, you know, what areas they might, or what people, that's sort of an offshoot of Cheryl's question, but I'm curious, sort of hyper focusing on, okay, who could I draw them in with?
So you're looking at the staff.
Mhm.
This
Oh,
is it.
okay.
We're all right here in your meeting. And I do that, as I said, for donors who I've noticed haven't given in a while, I start really digging into that. Obviously, yeah, I would love to do that more. That's a great suggestion.
Because I think doing your current people might, who are already giving to you, might expand their potential.
Yeah, Marianne.
Jennifer, I've got a lot of old school in me. And I like to talk to people, to pick up the phone. And the letters are great, but conversations for me make it. Even if it's to say, thank you, Mrs. Smith. Gee, that was a great gift you had. And to get a conversation going. I know it takes an awful lot more time, but for me personally, I've always had greater results that way, because then there's a follow-up and you can just glean so much information from that conversation. But, and I know if you're a party of one or a team of one, honey, I've been where you are many times. I get it. Sometimes you just got to say, these are my top 10 people, or these are the top 10 that need some love. So that's my focus this week. That's just my suggestion.
Kudos, Marianne.
Thank you.
Kathy?
Do you have a sense of the demographic of your donors in terms of age and things like that, of that nature, education?
I have a little bit of that. My donors, the age range, believe it or not, is from mid-20s up to mid-80s. I probably have one or two in the 90s as well. It's a pretty huge range. Other than that, the demographics, I don't get a lot of information. And no, I don't have a database dedicated to me. I use the bank's database.
Okay, thank you.
Jennifer, why should we give you money?
So you're going to give to the Univest Foundation to help you meet your philanthropic dreams. You have a cause you love. We can help you strategically fund them for the next 20 years, 30 years, 5 years, or beyond your lifetime.
Why can't I do that myself?
Very understandable. You could do that yourself. I understand while you're alive. We can help you go beyond your lifetime with a legacy. We also have the wherewithal behind us of Univest Financial to help that money be invested in the best way possible.
I'm a guy, I'm never going to die. And that's our attitude.
I don't like to use the D word when I talk to donors.
Any other questions? Maddie?
So apart from talking about how they could support a cause, or how they could support an organization, do you ever also highlight how it could benefit them financially, like in terms of you get a tax break, or so sometimes that could be a motivating factor for them to jump higher?
I partner with usually their wealth advisor, sometimes their attorney or accountant, for doing that. So I have the strength of what I know along with that professional as well.
Okay, let's move on to, are you interested in changing, Jennifer, your challenge statement? Has it been affected by these questions?
I think I might change it a little bit, and I might focus more on really engaging people's passions, that this is more about just upping their game to give to Univest Foundation. It's about upping their game to give to what they're passionate about, bringing the focus away from Univest out to whatever they give to, whatever that may be.
Okay. So a challenge question might be something to the effect of, how do I adjust our communication strategy in our engagement strategy with our donors? Okay, solutions. Everyone, raise your hands. Heidi.
When you were talking, the image of a dream catcher came into my mind, that you're capturing all these people's dreams and helping to make it a reality. And maybe there's some type of inspirational book you could send. You know, I know Bill Cummings has a book about philanthropy and giving, or just something to help inspire them, or hold a webinar that would, you know, talk about the impact that their donations have, or just to expand their sense of dream.
Okay.
Boy, that's applicable to everyone, I would say. Sarah.
So stories, I think, are really important in fundraising of any kind. And so it might be kind of interesting if you took a year and just highlighted different donors and the charities that they supported and what it meant to those donors to be able to do, to achieve what those nonprofits were achieving because of their donations. And again, that kind of plays off the dream idea, but actually through stories.
Great idea. Susan? You're muted still.
Yep.
Okay.
So feeding off Mary Ann, I think it's setting aside a couple hours once a week, an hour, half an hour a day, and just picking up the phone and going through, you know, from top to bottom, all of your folks, just wanting to say hi, just making that contact. I mean, I'm one of those people, I'd rather send an email than call sometimes. Though when I talk to them, I enjoy the talking, but inevitably it's much more of that personal connection and deeper connection. So
Fundraising 101.
Yep.
We all have those stories. So this is old school. And as far as I'm concerned, there's nothing wrong with old school ideas if they work. Right?
I was thinking of the direct mail piece as being an opportunity to ask for a stretch gift and be able to talk about, you know, you gave so much last year. Would you consider, you know, however you word it, but using their previous gifts to specifically raise their gift for the next year. And then maybe following up with a phone call is, you know, did you think about that? Did you get my letter or whatever? But
Cheryl, I would take that and raise you the following. There's something called a proposal appeal, where you put it in, you know, a large envelope, and it's hand addressed, and you're treating them as though they're a foundation funder. So you're actually writing a 3-4 page proposal with a cover letter, which is the ask. The proposal is the what, the cover letter is the ask and the why, essentially. And test that on some of your higher capacity donors. And if you get good results, continue. And the ask string should start at 1,000 or 5,000, you know, not at 100. And I can tell you from experience, this will give you pleasant surprises most of the time. Okay, any other thoughts? Heidi?
I really like the idea that somebody brought up about challenges. Is there a way for the bank to do like $100,000 challenge and they match every $1,000 gift? And get people into, do you have it against $1,000, or do you have that type of ability to invest in some type of challenge? I think that would be a great thing.
And tie it to the mailing. Tie it to the proposal mailing. If you give 1,000, the bank will match up to X. And this will be a way to begin getting donors to raise their floor, if you will. And those who raise their hand with a check are people you definitely call.
Or maybe not even the bank give the match, but it's a nice way to find someone to have a real purpose for upping their, so they provide one of your donors provides the match, or and people do like matches.
Definitely. All right, Jennifer, what have you heard here that stands out for you?
Lots of good suggestions is what I've heard. One of the ones that stands out is I do need to get on the phone more. I do talk to my donors quite frequently, but I need to make it more purposeful. You know, they'll call me about, can I give a grant to? I need to make those conversations regular and purposeful. Not only can you give a grant to, but hey, have you thought about XYZ, and talking to them a little bit more. I love the idea. I know it came as a question, not as a suggestion, but of that stewardship plan. And I think in that is going to include, you know, something like that proposal piece, definite calls, you know, making a timeline for those calls. And the match grant, I've got to look into that. Our bank has done that at times of community crisis or national disaster crisis, but I've got to look on making it as a regular thing and work on maybe not, and time of crisis, a non-crisis time.
And have them look at it as a business development expense.
Right. Yes. So a lot of those things. And I love also that story about highlighting some of my donors, getting their stories out. And that goes back to talking to them some more so I can find those appropriate stories. So yes, thank you. Lots of good stuff. I know there's more in there that I'm going to gel through and make it a point by the end of the day, right, Danielle?
By the end of the day, you answered my question. All right, everyone now, what jumped out at you as something that you might find useful in your own world? Kathy.
Yeah, I love the stewardship plan as well. And the points that mentioned Jennifer, just in whatever order, I'm sure they would all be wonderful to do.
I want to make a point that, you know, stewardship plans could be pretty easy. They could be essentially a matrix, right? Of here are things to do, and here are the categories of donors with whom to do it, and then build timeline out of that. And it's just a one-page matrix that could be your plan and guide you. Teresa.
I think it's always great just to have the reminder to pick up the phone and call the donors and bake it into your week. Make those 2-hour time slots or 1-hour time slots, whatever you can manage to make it a priority. I think it really is so important. So I think that was a great suggestion.
Super. Danielle?
I liked whoever said that working with your donors, it's like you're being a dream catcher. I'd never thought of it that way, but that's totally what you do every day. You just don't word it like that. And I think for people thinking about legacy, whereas you're at this foundation that they would be, that's a really good way to get it without it being, oh my God, I'm going to die. We're building your dream for now and forever.
Anyone else?
I like I just always resonate with the idea of stories and telling stories. And I know that in the hospital environment, it can be, there's a lot of good stories, and yet it's also somewhat limiting as to what you can use for stories. And being, like many of you, the one-person shop, it kind of gets on the back burner a lot. And yet then you go to write your, year-end appeal letter and you're scrambling around for stories. And so I think stories are pretty important. Good reminder.
And frankly, I like composite stories. You can take what you know is real and mold little creative writing and mold it into a Mary and Bill story that represent those people who benefit. Okay, I'm moving on. This is great. Everybody good? Candace, are you here? Where's Candace? No Candace.
I'm here.
There's Seawood at the bottom. She's here.
I'm here.
Oh,
Hold on.
am I missing something here? There's Seawood. Okay. You were incognito.
Yes.
All right, Candace. Director of Development, Middle Georgia Community Food Bank. I got started in food banking, but I won't tell you when. A long time ago. Opportunity statement. How does a solo development person make a serious attempt at major donor cultivation given the number of tasks involved in day-to-day management? I'll just share with you that when I got started in food banking in Portland, Oregon, in the morning I drove a forklift, and then in the afternoon put on a suit and went out fundraising and food raising. So the ultimate small shop. So
I'm not driving a forklift. I've got all day long to fundraise.
It's fun. I got to say, it is fun. All right. Solo, how many of you, just by a show of physical hands, how many of you are solo in your shop? All right, the majority. So this, I hope, will resonate for you. Questions? How many donors do you have in your file? Active donors, last 24 months.
4,500, give or take.
Know that right off the top of your head. That's great.
Well, so I've only been here about 100 days, so I am deep in the learning. But for me, this is the first experience I've had with we're a 40-year-old organization this year. So a lot of people give to the food bank, but I'm somewhat overwhelmed by all of the possibilities and opportunities. And how do I put that into a plan to start reaching into people? I wish I was like you, Larry, and had tried food banking, 30 some odd years ago. This is easier than some of the things I've tried to raise money for.
Oh yeah, this is pure philanthropy. This is altruistic giving.
Yes.
Pure and simple. Danielle.
Actually, I feel like we raise a lot of money without doing anything. What might I do if I actually had a plan and did something concrete?
That's
Right.
so my organization right now. We get money that falls out of the sky amazingly, and we love that. But you still got to do it's what can you do for the work? So I was going to say, what's your biggest need right now? Are you getting people that are donating to the right thing, or is there some disconnect?
So by and large, our money is just for general operations. There are a couple things that I've been thinking about. One is we work through food pantries, and I'd like to create an emergency fund for food pantries who might run out of money during the year or don't have the money to expand their capacity. So I am in Middle Georgia, which is rural, 24 counties, about 28% poverty rate. And we've got one county that is the poorest county in the entire United States. So we need to push money into those smaller counties versus, the city that I actually live in.
Teresa.
I have two questions. One, do you have a large database or a robust database, or are you using more of an Excel spreadsheet type of situation?
Somewhere in between. I have a database. I don't think it's as robust as I would like it to be, but it is there and I do have names.
Okay. And then my second question, as you were describing the area in which you're located, I was just curious if you partner with any of your health systems on like food pharmacy opportunities or things like that, where there may be some partnerships to help get this type of food in front of those.
So we just started in January with a fairly large hospital system right here in the city I live in. We're going to kind of play with that for a little while and figure out how many other hospitals we might take it to. But again, rural, which is an area where hospitals have been closing. So there are some opportunities, but certainly they're probably going to take a lot more funding than the hospital that we just partnered up with. But it's a great idea. I like it.
Candace, look at Boston Medical Center's program.
Thank you.
Jeremy.
Yeah, you mentioned you're in rural Georgia. I'm wondering if you're partnering with any of the churches in your area.
I would say that 90% of our partner agencies are churches. Kind of amazing to watch what really small churches can do. I don't know the stats. I do know that we get money from hospitals. I know that yesterday we got $1,000 check from a small church. So yeah, we're in the South. That's where we start, churches.
Yeah. Marianne.
They probably, my question was going to be, do you have a board or a volunteer group? Or, you know, I come from the Catholic school education world 1,000 years ago, and you learned a lot in that you depend upon volunteers. And if there's a group that can help you network, or you go see Mrs. Smith and maybe Mrs. Smith gives you $50 or $100 or $1,000. Mrs. Smith, whom else should we be talking to? Who could, you know, ask who else she knows or he knows. I know it's tedious work and it's, you know, grassroots operation, but if you can get one or two key people that take an interest, then you start to build your core subcommittee group or major gifts committee or somebody that, you know, whatever you want to call it, you know, just a thought.
So are you, Marianne, are you basically asking, does she have a development committee?
Right. But maybe you don't. I don't have a development committee, and I'm just going to start one here. I'm going to start a few committees here. But my point is that, you know, even among your board or advisory council or whatever you might have, I tap into them just to cold call. How can you help me?
Hey, this is solutions. We're asking questions.
Oh, sorry.
Right?
Sorry.
So do you have a development committee?
I have a board, a small board. I don't think we have a development committee yet, but it is a great idea. And we are not using volunteers. In the past, we've used volunteers to sort food, but I do like the idea of a volunteer committee to help me grow our reach into the community.
You bet. Rebecca.
And how large is your board? Did you say small? And have they done any fundraising? Are they connected?
I think one or two people on the board may be connected. I haven't heard that anybody has brought us any gifts. I did have one board member reach out to me and say, come talk to me. You know, I know what's going on in town. And he is on my list. And they all do give, but this is the 2021 was the second year that we required that. So they're new at this.
Ms. Piper.
Yeah, quick question. What does your marketing social media look like?
And okay, and kind of in line with that, what does your storytelling look like? There's a lot of really good stories with them.
So our storytelling is not good. Our social media is limited. It's kind of one of the things I'm noodling about right now is how do we come up with a plan and who gets to do it? I feel like, so I have a long history of fundraising, but I feel like I landed here with a whole bunch of skills and then they said, okay, let's learn a whole bunch of new skills. Like, how do I make Facebook work and how do I make Instagram work? So I'm working on a plan for how many people do I need to help me, even if it's an intern to help me do Facebook and Instagram. So we have a long way to go. And it is a perfect reach. Interestingly, we have what we call mobile food pantries where we'll send a truck out to a community and we post that every Monday. And so I've learned about where I work from all the people who write me Monday morning at 6 a.m. and ask me questions. But it shows me that our spread on social media is growing based on everyone sharing where can you get the food. And they do respond when I put up good news.
Great. Rebecca.
My hand must have been left raised.
Okay, Heidi.
I was just kind of curious, as you know, I've been a one-person shop before, so I feel your pain. How do you plan your day? Like, how do you structure your day?
Well, at the moment, we're still working on the crisis by crisis. So we start off the day with a crisis and then a plan for what are the things on my list. So again, I started just 3 months ago. So I'm trying to figure out how to build a year. But we got lucky and we are getting a new addition on our building that starts May 1st. So I fell into, it's the holidays, everybody wanted to donate food. So I managed a whole bunch of food drives. Then there's a building project. So I'm working on the getting up, standing in the shower and going, okay, what are the things I have to get done today? And what are the projects I might move down the path just a bit?
Joel.
I have two quick questions. One, you mentioned it's the 40th anniversary. Is a campaign or celebration something that you're thinking about for the year? And then the second, and I'm just thinking about major donor cultivation specifically. And then the second question is, if you have direct mail, has the food bank entertained segmenting that based on donors' history of giving, so that folks who've given $1,000 or more are getting asked to give $1,000 or more versus everybody asked for the same amount?
So we do have a direct mail program. It's kind of new also. We started doing acquisition mailing like last September. We had pretty good response. About 10% of people responded.
To acquisition mail?
Yeah.
That's off the charts good.
I know. So that's what I'm saying. I have lots of opportunities, but how do you prioritize and tackle them and make them turn into money? So yes, we've done well.
Great. Good questions. Kathy.
Curious about whether you have any corporate support, banks, hospitals, you talked about the hospital piece.
So we do have corporate support. Some is in the form of food. There are major food companies in our area who donate food. We also have, because we're part of Feeding America, we have been very lucky at getting grants from major organizations to help either with general operating or with specific, programs. So I think we do pretty well there too.
Okay, good question. Teresa.
Have you created a portfolio for yourself of either top 10, top 20 donors that you're going to focus in on?
Very roughly, but I haven't done a plan for them. It took me a while to kind of figure them out, who was there. we had a couple challenges with our software, but I finally have a list. And to be honest with you, I made my first call yesterday to somebody who'd been giving $1,000, $3,000 a year, who wrote a check last Friday for $5,000. And so it was my first chance to get to make that phone call, and it's such a great feeling. But yeah, I probably have a list of 20 people who I think have real potential.
That's great. Hey, Joel, do you have another question? Or your hand just still up? There you go. Okay, you're good.
My bad.
Leslie.
Just something piggybacking goes for a lot of this, but a question is, how many of your supporters and people that you're talking to do you have their emails for? Because when I'm thinking of it being a small organization and how you can save funds on the other end, that would be very helpful. And I with these squares, I keep having to look. There you are, over there.
So I think I said 4,500 active donors, about 1,000 emails. And I think that's probably one of the things that I want to figure out. How do I get more emails and we can stay in touch? I heard someone talk about emailing a couple times a month and went, oh, goody. Thank you.
I'll ask a question, Candace. Do you use Feeding America's network and talk to other food banks in the network that are in your situation?
So I've just begun doing that. And Feeding America actually has a system, you know, with a place where we can go ask questions, and I've already learned a couple things from people who put something up and said, we're going to create an advisory council of our partners who actually deliver food to people. So I've just begun doing that. Yes.
Very good. Okay, moving on to, my guess is that, Candace, you're not going to change your challenge statement. It's probably as universal as it comes. So let's hang in there with that. Solutions, everyone. I'm going to start by saying do more direct mail acquisition. At 10%, you're more than paying for the costs, and do what's working. Keep doing more of what's working. Danielle.
It's overwhelming to come in and have so many possibilities. I just started in August. I get that. What's worked for me is physically writing down, what do I want to accomplish in the next month, in the next whatever, and try to, on the 15th, schedule my calendar for the next month in advance. So then you actually have the space on your people's calendar before they've booked it, and you actually do the meetings you need to do, and you can break it up into, I'm doing my calls today, I'm doing my research on social media today, whatever it is, if you need to bounce around, but put it in writing and hold yourself to at least getting one of those tasks done per day. And it makes it easier to break up and do. Good luck.
Thank you.
Kathy.
Well, I like what Jeremy said about the anniversary, because the Plugged In Band program here, we actually are celebrating our 20th anniversary, and we did our own Day of Giving in last September, which was a very interesting. So I think, you know, and we're capitalizing on that anniversary throughout the year, you know, so.
Very good. Maddie.
So until about 3 weeks ago, I was a one-person shop, so I totally get what you're going through, and it is hard. So one of the things that really worked for me was to get more people involved, like get more volunteers, get committees involved. So once you have that, then you can basically give some of your tasks to them and ask them to take ownership of that. So make sure that you get them involved, make them feel like it's their project, their baby as well. And so that way they are responsible for it and they rise to the occasion.
Good. Leslie.
I think what I just jotted may have already been said, but earlier you mentioned possibility of establishing a committee. Was that what was just discussed? I'm sorry if I missed it.
Yes. Yes.
Okay. Being familiar, I was going to say to, for say an advisory council to look at previous board members. You say it's been in existence for 40 years, but also look at the loyals and majors, and having come in the past to an organization that did not, the board was not a fundraising board. It was the advisory council who then became at the helm and helped to move the organization forward.
Joel.
This kind of ties in with a stewardship plan, but you mentioned having a lot of contacts, but not their emails. Something just as simple as the handwritten note, but offering to follow up and have a meeting with them and putting in a business card, and then they respond via email. And next thing you know, you're back and forth via email, and you're asking them if they can sign up for your newsletter. You're cultivating a deeper relationship with them, and that's all very much within your control.
Thank you. Kathy.
So we have a youth board. So I'm just curious if you have individuals that are food insecure involved in some way.
I haven't heard of anything like that, but I love the idea.
Okay. Leslie, do you still have a question? Or no? Lower your hand. Okay. Technology. No? The good and the bad and the ugly. Any other thoughts about Candace, some solutions for Candace?
I was going to say that one thing that we at the hospital are always hiring people, hopefully, and we do orientation every couple of weeks for new employees. And I get the opportunity, which is great, to talk to our new employees. But what I do is talk about how I am a quote one-person shop, but I do consider everyone at the hospital to be part of the philanthropy department, and that their work and the comments that we get from people and how much our patients and people that use the hospital appreciate how kind everyone is, and the atmosphere of the hospital, they're all helping me and my job be easier. So I kind of put the onus on them that they're part of philanthropy, whether they think so or not. And that I may be a one-person shop, but I'm like ultimately a 550 person shop, because everyone is part of how people feel about the hospital and whether they're going to then donate to us. And then the other thing that I was going to say is, as far as like all the social media and stuff, I wonder, especially for something like a food pantry, if there isn't a, high school group or something that could kind of take that task on. And, if you have technology issues, it's nothing better than going and talking to a 8th grader. So maybe they could help take over or help with social media or whatever. There's probably some high school group, technology group or something that they could get. They might even get, I don't know, credit somehow in high school for doing that for you. But anyway, it's all a lot. And
Cheryl, I want to tag on. In my early days in the 80s, the most important people in the food bank were the truck drivers who delivered the food to the pantries in other parts of the state in Oregon. They were the ambassadors that the faces that the public saw, and were in fact featured in our fundraising materials. So, to expand on Cheryl's point, featuring the mechanics of the food bank and the people behind the mechanics will help people in their giving. They'll see the person they're sort of supporting to do the good work. Okay, good stuff. So Candace, let me ask you, what did you hear that stands out for you?
So I heard a lot of things too. I love the 40th anniversary campaign idea the best. I don't know why that one didn't dawn on me. And the fact that we're getting a new building, you know, we're going to be bringing attention. And I like tagging that on to see if we can't get people to respond and give me their emails. So I want to tell you, this has been my best morning in the last 90 days. Thank you all very much.
Wonderful, wonderful to hear. Wonderful to hear. Folks, what stands out for you? What have you heard that you're going to be able to take back to your shop? Teresa.
I think the volunteer piece and leveraging the group of volunteers, I think a lot of times, especially since we're professional fundraisers, you know, we tend to do things ourselves, and over time philanthropy has gotten away from using volunteers as much, and they're so critically important to our success. And many times when folks are contacted by their peers, they're more likely to make a gift, and a larger gift at that. So just a really important reminder for me.
Good point. Kathy?
I love what Cheryl said about meeting with the new employees. I remember doing that, and I had totally forgotten that I did that like 10 years ago, meeting with new staff and talking to them. But everyone is the face of philanthropy in the organization.
It's the best way to begin building a culture of philanthropy.
Oh my gosh, yes.
Maddie?
No, I was going to say the same thing. I really loved what Cheryl said, just because, you know, it's not just one person trying to raise money, but it is a team of like every employee and every volunteer is the face of philanthropy. So that's a good point.
I keep forgetting about the anniversary stuff. I think that thinking about that in our own organizations, because there's so many things that you can bounce off from with that. So if it's your 40th anniversary, you know, maybe everyone could give $40, or, I mean, too bad it wasn't your 400th anniversary, but
that's hard.
Yeah, okay. So I forget about that kind of thing, and it takes a little bit of advanced planning. So thinking ahead of what kind of anniversaries that you could build off from for a campaign, or even a minor campaign, is something I will keep in mind.
The cautionary note on anniversary campaigns is it's about the next 40 years. You know, you honor what's happened, but it's all about the money is for the next 40 years. Lisa, you have your hand.
Yeah, a lot of good stuff. And I think I'm fairly new in my position as well, but the one key point that I think you had made was if you can identify what's worked previously, and in this case, it was the acquisition mailing at a 10% return. But if you can find something that has been successful, to not let it drop, just to kind of keep an eye on that, keep going back to it, realize on that.
It's easy to forget, isn't it? You get busy with stuff, it's easy to forget. Joel.
Yeah, I think this is, and I can certainly relate to this, as Love & Spoonfuls similarly supports a lot of other nonprofits, that giving to us is a multiplier, and that you are supporting this network of agencies as well. I talk about that a lot, but it is a helpful reminder, and that's something that can be woven into conversations or marketing materials and things like that.
And Joel, to feed on that point, in food banking, a lot of appeals monetize it. For every meal, every dollar means a meal. So that people can capture the plate in front of them as what their $1 does, or these days it's probably $2.50, but right, no, it's still around $1. Cost of food? Okay, good. Anything else? Anything else stick? All right, hey, listen, we're there. This has been a great hour and a half. You've all been fabulous. Really, really great conversation. I hope you feel the same.
Thank you.
And I know we have some return visitors. You must find this valuable, and that's super. Please keep coming back and sharing this with others. I'm going to keep trying to do it every month or so. And so go forth, be fruitful, use some of these great ideas, keep up your good works.